So first question, which of the following isotopes is most commonly used in HDR brachytherapy? Iridium 192, palladium 103, iodine 125, cobalt 60, yttrium 90. Yttrium 90 is used in radioimmunotherapy. Cobalt 60, as we know, is mostly used in EBRT. Palladium 103 and iodine 125 is used in LDR brachytherapy. So the answer over here is iridium 192, which is used most commonly in HDR brachytherapy. Second question, iodine 131 tocilizumab, also called as Bexar, is option A, radiolabeled small molecule TKI used to treat lung cancer. It is neither a TKI nor used to treat lung cancer. This is so wrong. Option B, used to treat thyroid cancer. So only iodine 131 is used, but this is an antibody attached to it. So this is also wrong. Of limited clinical utility because of its high toxicity to GIT. No, it has more of hematogenic toxicities, not GI toxicities. Option D, it is a radio-labeled antibody against CD20 antigen overexpressed in NHL cells. So this is the right answer. Option E, it is highly effective in cell killing because of high LET alpha particle emissions from iodine 131. No, it does not have alpha particle emission, it has beta minus and gamma emissions. Now, without even of the knowledge of the tocilizumab, you could have answered this correctly, because MAB, if you know, it is a monoclonal antibody. So among the option, this is the only option which has antibody in it. So we, even without knowing any info about it, you could have answered this correctly. So option third question, a primary advantage of HDR brachytherapy for the treatment of prostate cancer is option A, OER is expected to be lower for HDR than for the LDR. This is wrong because it is expected to be greater. Option B, the probability of the late normal tissue damages decreases with the increasing fraction size. Now this is also wrong because it increases with the increasing fraction size. Option C, tumor response should be improved by using larger fraction size because of the lower alpha over beta ratio associated with prostate cancer compared to that of the surrounding normal tissues. This is correct because alpha over beta is lower, about 1.3 to 1.52 for the prostate cells, and the normal tissues have around 3. Radiation, option D, radiation safety issues are generally less concerned for HDR versus those for LDR. This is also wrong because LDR requires lesser shielding than the HDR. Option E, HDR brachytherapy allows for better coverage of regional lymph nodes. That is also wrong. So the correct answer over here is C. Fourth question, brachytherapy has been used to treat ocular melanoma using multiple radionuclides. There is clinical data on the use of all of these isotopes except. So ruthenium is used, cobalt 60 is used, iodine 125 is used, palladium 103 is also used. So the answer over here is D, iodine 131 is used for thyroid, not ocular melanoma.